Hi, my name is Anna and welcome to Dr. Midnight. In this video, I will talk about the basics of Harada. The Harada Syndrome is a rare autoimmune disease that was discovered by doctors Alfred Vogt, Vogt-Koyanagi, and Meia-Noite. It attacks melanocytes. To those who don't remember, what are melanocytes? Melanocytes are the cells in our body that contains color. And these cells can be found in the central nervous system, in the inner ear, in our eyes, in our skin, and in our hair, of course. So those are the tissues, the targets of the Harada syndrome. The Harada syndrome can be characterized by two categories. The complete syndrome is characterized by inflammation in those tissues that I mentioned previously. And the second category is incomplete syndrome. The incomplete syndrome can be characterized by inflammation in all those areas except the inner ear. In my case, I have the incomplete syndrome. How does Harada syndrome start? First of all, we have to know that Harada's is characterized by 4 stages. The first stage being called prodromal. The prodromal stage will rarely be noticed by the patients or by the doctors even. The symptoms are very common. They can't be associated with a disease like this immediately by no one really. The main symptoms of this particular phase is stiff neck and maybe some flu-like symptoms, and that was described in a few studies. A few weeks later, we will have the manifestation of the second phase called acute uveitic or uveitic. I don't know how to say that in English. But anyway, this is a phase that most people will seek a doctor, because that's the phase when you will notice your eye will become red, and I mean super red, almost like a ball of blood. The patients will notice a rapid decrease of visual acuity, and the intraocular pressure might be a little high. Some doctors in this phase might erroneously diagnose patients with conjunctivitis or pink eye, and we have to be very careful about that. The third phase is called convalescence. As the name suggests, the syndrome now starts to make you think that it might be going away, but actually it isn't, because from the ophthalmologic point of view, it might be stationary or seemingly stationary, but the inflammation will attack the other tissues, and that's when vitiligo and poliosis and meningism that is, and damage in the inner ear might occur. And then comes the fourth phase, that is called recurrent. That's when the patients will experience several flare-ups of uveitis, and that may last for a few months or years. Nobody knows. It depends on each individual patient. Treatment. The treatment is usually a high dose of prednisone associated with immunosuppressants. The use of each immunosuppressant will depend on each individual patient. The use of prednisone is usually characterized by high doses, and that is 40 milligrams or above. Anything below that is not going to cause the desired anti-inflammatory result. It's important to talk about 2 main things. There is something called attack doses and something called maintenance doses. protect doses in prednisone use means that we will use 40 milligrams or above to create an anti-inflammatory effect on the organism. Anything below that is what we call maintenance dose. What is a maintenance dose? A maintenance dose basically is weaning off prednisone gradually to not generate any setbacks on the organism and to not generate another flare-up due to rapid prednisone interruption. That being said, it's important to diagnose quickly diseases and to start a treatment with prednisone as soon as possible because you want to save the vision of the patient. And let's not forget that Harada is a very important cause of blindness, and I am the living proof of this. So it's important to take care. Alright, so that will do for today, and next time I will cover some topics about prednisone and its side effects, and I will also talk about mental health related to Harada syndrome and other autoimmune diseases, and I will also talk about what could possibly be the origins of this particular syndrome. So if you have any questions or if you just want to share your story, you can always post a comment in the comment section below, or you can write me an email at ana.drmidnight@gmail.com. That is ana.drmidnight@gmail.com. Thanks for watching, and I will see you next time.